Living Clean, Living Well is a presentation of the Canadian Centre for Abuse Awareness and is brought to you by Turning Point Detox and by Renaissance. The road to recovery starts here.
Welcome to the show, everybody. I'm your host, Teresa Cruz, and we are live here, coming to you from our studios at CTS Television in Burlington, Ontario. As I always say, it is great to be welcomed into your homes and your lives once again. You're watching Living Clean, Living Well. And coming back to our show, a very popular guest that everybody loves when you're sitting in that chair. This is Dr. Vera Tarman, who is the Medical Director of Renaissance. Good to have you back, Vera. How are things?
They're great, and I'm really happy to be back. Thank you.
Mm-hmm. You know, we were very pleased. A couple of weeks ago, Renaissance launched the first ever Peter Armstrong Community Awards of Excellence, and our show, Living Clean, Living Well, won. You may remember last week, if you were watching, I was telling you all about it, and what a proud honor it was. Here's a couple of pictures from that special day at the Granite Club in Toronto. There is Peter Armstrong presenting to Ellen Campbell, who is our CEO and founder of the Canadian Centre for Abuse Awareness, and I'm there, and you'll see Sanderson Lang there off to my right. And here's the happy group. So there's Sanderson, Ellen, Peter Armstrong, myself, and Dr. Patrick Smith. So it was a very, very proud day, and Vera, it's nice to be recognized, so thank you so much.
Oh, sure. I mean, we're delighted to be part of this venture of sponsoring the show and having me come on and other guests come on from Renaissance. I mean, we're just delighted to be able to do that.
Yeah, every Sunday night when I go home, and it's rather late, but you know what, that's okay. But you know what, I'm always thinking, man, we did some good work tonight. Do you always feel that way as well?
Mm-hmm. Yeah. Or at least planting the seed somewhere for somebody who's in a despairing place or needs to hear some hope.
Yeah.
Yes.
So speaking of which, our phone lines, our toll-free phone lines are now open to you. We're going to have the numbers up there on the screen, and there they are right now. If you have a question, perhaps you're struggling, perhaps maybe a family member, any questions at all to do with addiction, substance abuse, sexual abuse, trauma, we're here to help you. This show is a proud presentation of the Canadian Centre for Abuse Awareness. So our phone lines are open. If you want to ask Dr. Tarman a question, and if there's something that she can't answer, we can certainly find the right resource for you. So we usually like to start our show off while we're waiting for your calls in talking about a few issues. And but before we go to our issue of the day, I wanted to talk to, there's so many different types of addiction, and I know one that you deal with, like Dr. Tarman deals with all addictions, but one that is very near and dear to her heart is food addiction, which, starting this show, had no idea about food addiction, but how did, you just had a recent workshop, did you not?
That's right, we had a workshop yesterday it was called the Food Addiction Intensive Day. And we had a number of people, it was sold out. We had 15 spaces, or actually 12 spaces, and 15 people wanted to sign up. And so we did a day where we introduced the topic and started to do some therapeutic work. And was very successful. I think we decided that it's such an issue that has so many issues attached to it. Emotional stuff from the past, and how do you live without and comforting yourself with food, that we decided we're going to have to do it again, but with 2 days, just because there's not enough time. It's really just a taste of what really needs to be done. So we're hoping to do that maybe in the fall sometime.
That'll be good, and we'll be sure to have you on, and we can let people know when it's going to be happening. This is an addiction that you yourself struggled with.
That's right. Yes.
Yeah.
Yes.
Tell our viewers at home about it.
Well, it's an issue that I've struggled with, and I would call myself a food addict in recovery now, because I've basically what I did is I figured out that there were particular foods like sugar and white starches that I just had to treat like a drug, and I had to be abstinent from. And I found that once I did that, I basically felt not only physically much better, but mentally much better, because I no longer had the obsession in my mind. Because it's an area that is not acknowledged yet, it's beginning to be in the public media, but it isn't yet in the scientific community. I've taken it upon myself to make it as public of an issue as possible, so that those people out there who get scoffed at or wonder if they have a problem actually know that there is a name for this and there is potential treatment for it.
And at one point you were quite heavy, you were telling me.
Yes, that's right. I was about 100 pounds more than I am now. And I've managed to keep that off because, you know, it's hard to lose a lot of weight. But one of the things that people realize is that it's hard to lose weight, but it's even harder to keep it off. And I kept losing and gaining the weight until I adopted the strategy. I mean, yes, you can stop eating foods that will make you heavy, but I didn't realize that I had to just not eat some foods at all ever again, one day at a time, so that I wouldn't relapse back to overeating and regaining the weight. That's the part that is a real, it's really painful for people. It's they lose the weight and then they get so discouraged because they gain it back and there's that cycle of weight loss, whatever. But it's actually possible to lose it and keep it off forever, well, as long as you, but if you don't reintroduce the substance, which, you know, that's why we're calling it a food addiction as opposed to an eating disorder.
So you actually, so sugar and some starches, things like that, you literally have to abstain from?
That's right, I abstain from them.
Wow, so you can't even have them in a small amount?
Not even in a small amount. And people will often say, but you can afford to do that because your weight is fine. And I say, I can afford to do it physically, but I don't want to introduce the mental obsession into my brain. And I don't want to be struggling with that, you know, because once I have one cookie, I want more. And I'm now so relieved of that craving, that the one cookie is not worth the headache, I mean, the literal mental obsession that follows. So, I mean, it sounds like it's hard to do, but it's actually not hard to do. I always think, you know, when I go to a buffet or something and there's all that stuff there, I think, yes, I'm missing something, but I'm gaining so much more. Peace of mind, you can't buy peace of mind. It's not worth a cookie or a cheesecake or some of those things I used to love eating.
So you treat the substances of sugar and some starches like somebody who struggled with alcohol or a drug or something like that?
That's right, that's right.
Wow.
And really my biggest struggle now, because I feel quite peaceful about that, my biggest struggle now is trying to let other people, have other people respect that decision, because people don't get it. They think, oh, you must be really depriving yourself, or, you know, it's better to live a happy life than this, and because they don't understand how freeing it without that obsession, how freeing it is. I don't feel deprived at all. I feel quite relieved. Yeah.
Well, we also wanted to talk about another issue, which is in the area of harm reduction, specifically marijuana. I want to get into this, but I would like, we've had a phone call, so shall we go to the phone lines early? Let's not keep them waiting. Let's go to line 4, and Mary's calling in from Hamilton tonight. Hi, Mary, you're live on the show. Mary, are you there?
Hello?
Hi, Mary. You're live on the show, and you're talking to Dr. Tarman. Go ahead.
I have a question about methadone treatment for OxyContin addiction.
Yeah, go ahead.
Is it? I've heard that methadone treatment can be a lifelong treatment, and that it is as addictive as the OxyContin itself. And do you think it's an appropriate treatment for that? Is it a...
Well, are you finished your question?
Yes.
Yeah. It's most definitely an appropriate treatment. It's not the only treatment that there is. I mean, there's just abstinence, going through detox and getting off of it that way. But sometimes people find that they just can't do that because the opiate withdrawal is so painful and so long that they just find it impossible. And if you're in that kind of situation, or you know someone that is, then it's a very appropriate treatment. It doesn't need to be a lifelong treatment. It can be as little as 3 months or 6 months, and in fact, some people use it now for, you know, under a month, because what the goal is to stabilize the person and then taper them down and get off. But generally speaking, I mean, methadone treatment has changed over the last few years, and initially it was thought that it's a good idea for a person to be on it for about 2 years, because you get stable and then you start to learn how to deal with addiction in like all of the cues and all of the psychological issues, like you have to get rid of the friends that we're using and change your life basically. And it was thought that 2 years was a good amount of time. If you got off before that, it might be premature. But now what's happened is a lot of people have gone past the 2-year mark and are just, if they're doing well, they're nervous and they don't want to change. If they're doing well, they don't want to change it. And then there's a lot of other people who have found that if they stay on methadone, if they're not really ready to stop using drugs, either OxyContin or heroin, that they can still use those drugs on occasion, like on the weekend or once in a while, and not get sick. So it ends up being what was supposed to be a bridge from using to sobriety. What ends up happening is that people get stuck in that bridge point forever. But you don't have to be in that place. And the doctor would probably be really happy to help the person get off at a certain point.
Yeah, some good information for you there, Mary. We're going to take our first break here on Living Clean, Living Well. When we come back, taking more of your calls and questions with Dr. Vera Tarman from Renascent. We'll be right back.
Not knowing what to expect when I got to Turning Point, because Michelle, my wife, made this all up or organized everything for me, I just was totally surprised when I got there. Like, I didn't know what I was getting into. If it was going to be like guys walking around in white coats and stuff like that, I didn't know what I was getting into at all. I just pulled up and they greeted me with open arms, of course, the guys that were in the program at the time. And the house sitters that were there was, you know, I sort of went, wow, what have I gotten myself into? But as it went along, it was all comfortable. They made me feel comfortable and met the guys, got along great. The one-on-ones that you have with your counselors there are just amazing, and the things they teach you. The group sessions you have with all the guys that are there and the counselors, and all the inputs and everything that everybody has, you get so much out of it because they teach you how to learn to use your tools. The tools are the main thing.
When you find you're slowly going under and the light only makes it harder, the light only makes it harder to see. I will be your shelter from the thunder, just as long as you give this promise to me. And let me walk you to the water. If you just let go, you will come to know what I mean when I say that it's okay to be this bold. I could ease the hurt if you only turned at my word and you do me this honor. Let me walk you to the water.
Well, welcome back to Living Clean, Living Well. Our guest tonight, Dr. Vera Tarman from Renascent. She is the medical director there. We want to talk a little bit about a couple of issues as well. And Dr. Tarman and I were talking before the show, and she suggested the area of harm reduction, specifically using marijuana. Is it safe or a good idea, or should you avoid using a drug of choice like cocaine and opiates, or do you use the marijuana? So, Dr. Tarman, this also a controversial issue. Mm-hmm. I'd like to hear what you have to say about harm reduction.
Okay, well, in specifically about marijuana, it's a lot of people who use drugs, it's very few people are just using one drug. It's polypharmaceutical or whatever. It's they're using marijuana and cocaine or alcohol, but usually marijuana somewhere in the backdrop. And when they get into trouble and they need to stop using their cocaine or their alcohol or their opiates like oxys, they find that it kind of softens the blow when you're getting clean by smoking marijuana. And in some cases, it can be quite effective.
We've had phone calls about that before, people talking about that. Yeah.
And in the community, in the street, it's called the Marijuana Maintenance Program. I'm just going to maintain myself on marijuana. I'm not really clean, but I'm better. I've reduced a lot of harm by being on marijuana. And I guess if you're looking at it from a harm reduction point of view, and it is actually saving money and all the rest of that stuff, then it's fulfilled its goal, and I can't really argue about that. But if you're taking that point of view that I'm going to take, which is as an addictions doctor who wants to get a person well in terms of good physical and mental health, I can't really condone it because it is a drug like the other drugs. And one of the things that we know about marijuana is that the potency of marijuana since the 70s and 80s, when it became so widespread and got that reputation as being a soft drug, is that since then until now, the potency has increased dramatically, exponentially. It's become quite a powerful drug. And I would say just as powerful as the other drugs on the scene.
Really?
Yeah, and when we talk about addictions now, the more and more it's becoming clear that it's not really about the substance, it's about what it's doing to the brain.
Right.
And it goes to the same neurochemicals that alcohol and cocaine do. So, I mean, really, what difference does it make? And some of the things that people say about marijuana is, well, it's not so bad, it's not addictive, but if you've seen enough people on marijuana, coming off of marijuana, I'd have to say, yes, it is addictive. There is a pattern of withdrawal that you can actually identify that you can't question that it's not, it doesn't have a withdrawal pattern. It has cravings, people obsess about it, they're smoking it every day. It has physical impacts on the body, on the brain, that are not negligible. Yeah.
So there's a few interesting points about a very controversial topic and an issue that is out there. We've had, as I mentioned in the past, a lot of phone calls about it. I'm going to put that out to you tonight. What do you feel about using marijuana as a harm reduction type thing? What about the medical marijuana program?
Yeah.
Your thoughts on that? So we'd like to hear what you have to say. We're going to go back to our phone lines right now, and on line one, Colin is calling in from Kitchener tonight. Hi, Colin. You're welcome. You're on the show, and you're talking to Dr. Tarman. Go ahead.
Hi, how are you?
We're doing well. How are you?
Hey, Colin.
Oh, I'm doing quite well.
Good.
Yeah, I just wanted to talk. I know what you're dealing with, like marijuana addictions. Like it's okay that you're on this marijuana and stuff like that. But
Yep.
I'd like to note that sometimes marijuana can have other additives in it and stuff like that. I've been on the Methadone program myself, and with drug dealers, you don't know exactly what's going to be in the marijuana. It could be PCP, angel dust, everything like that.
Yep.
And, you never really know what's going to be in it. And a lot of the weed now is getting so strong, like, what's next? Are you going to get, a bag of weed and be able to drive around your car? And it's completely unsafe in my opinion. And still, people say that, but if people have done hard drugs and stuff like that, if they keep smoking weed, honestly, I think it might be 6 months, might be a year, but most are going to relapse back into hard drugs.
Yeah.
I'm 100% sure.
Yeah.
Now, Dr. Tarman, your thoughts on what Colin has to say tonight?
Well, Colin, I have to say that each of your points, you hit it right on the head. That's it exactly. I mean, think about it. Do you want your airline pilot to be smoking a joint while he's taking off?
No.
No. Next to alcohol, marijuana is, that's the second reason for motor vehicle accidents because of impairment. And we don't have a way to measure it in the same way as you can't stop the person and do a blood alcohol level, blood THC level in the same way. But thank you for bringing up that point, because it's a major cause of motor vehicle accidents. And you also mentioned something. What else did you say?
It being cut with certain
yes, they cut
things.
with yes. I mean, one of the things that I do is I urine screens for people, and people who say that they only smoke marijuana and that's it. And I believe them. They say that that's all they're smoking. And I will find cocaine in there sometimes. I'll find other substances in there sometimes. So you're right. You don't know what you're smoking out there. It is mixed with a lot of things, including other drugs that are pretty addictive. Yeah.
Good insight, Colin. Thank you so much for that. We're going to go to line 2, and calling in from Tisdale tonight is Brent. Hi there, Brent. You're live on our show tonight. Go ahead. The floor is yours.
Well, hi. How you doing? I don't really agree with your last caller, In fact, I've been an avid marijuana smoker since I've been 14. I've drove heavy equipment from here to right across Canada, semis, buggies, cats. It doesn't impair you that much. It's like nicotine. You get so that you don't even get the quantity or the toxicity. You get immune to it. You don't even get high anymore. But I hear it's actually really good to fighting cancer, hypertension, arthritis, glaucoma. But I was kind of wondering if it does cause depression, because it is a bit of a depressant like alcohol. Because I know alcohol does cause a lot of depression.
Yeah, Brett, thank you. Dr. Tarman, your thoughts?
Yeah, that's it does have contribute to mood disorders. It's interesting that you said depression, because research has shown that there's some increase in anxiety, and some people will say that they have a flare-up of panic attacks, but actually it's more depression than it is anxiety. And it would make sense, because we're not really sure where in the brain, in terms of the neurochemicals, it goes, but it seems to go to the same place that alcohol goes to. And even though some of the marijuana actually acts as a stimulant, one of the plant types do, it does seem to have more of a connection to depression. So I think you got that. The other thing that we know, and we just keep finding more and more research to show this, is that there's a really high link between marijuana and schizophrenic psychosis. Not really sure why that is, if it's because it's already latent in the person and the marijuana brings it up, or is it because it actually brings on new schizophrenic? We don't really know. But a lot of people will say that they get paranoid when they smoke marijuana, and even if it doesn't become a psychosis. But there are some people, like a small population, where it actually they develop schizophrenic symptoms even a year after they've started smoking. It's not like right away. So it does have an effect.
And you can build up a tolerance to it.
Well, you can build up a tolerance to it like you can build up with any drug. And whenever you develop a tolerance, one of the things that happens is you're going to have a withdrawal, because you build up a tolerance, you stop the drug, and then now you need that amount to feel normal. And when you stop, you're not going to feel normal. You're going to feel more anxious. You're going to not be able to sleep. You're going to feel really irritable. I mean, it has a withdrawal. And I'm going to guess that if you're already tolerant to it, when you don't have it, you're probably really anxious and really depressed and can't sleep and very irritable.
Well, Brent, thank you so much for calling in tonight. Let's go now to line 4, and Shannon's on the line from Woodstock. Hi, Shannon.
Hi.
Hi, how are you?
Good, how are you?
Good, thank you. Have you got a question or a comment for Dr. Tarman?
Yes, I have a comment about the first caller, which was about methadone.
Yes, Mary.
First of all, like I've tried smoking pot many times, like when I was younger, and it never did anything for me, and it never does now. It doesn't do a thing for me, neither does drinking. Once I found the opiates, I've been a pill popper for 15 years. And that's what I call myself, a pill popper. And I tried and I tried and I tried. You know, getting off, going back on, getting off, going back on, so many times.
Yeah.
I can't even tell you. And once I found the perks and the oxys, that was it. I never wanted to live without them. And then I've been on methadone since September. And I feel like it's saving my life, to say that. However long I stay on it, I know if I'm being honest with myself, if I do go off of it, eventually I'm going to go back onto the pills. So, I know you can stay on it for as long as you want, including lifetime. And it's also good for chronic pain, which I have. So, I mean, I just think there's so many people say a lot of bad things about it, but it's actually a miracle cure for a lot of people.
So Shannon says that it saved her life. Your thoughts?
Yeah, I've actually had a number of patients say that the very same thing, and the way that you're describing it is really how it's intended to be used. There are some people who say, even if it's a psychological dependence, they're feeling better, they don't want to go back to that craving place that they were at before, and they're quite happy to be on it, even if they think they'll be on it for the rest of their life, because it is such a lifesaver. I mean, that's why it was introduced, and that's why it maintained itself. It was, really, really helpful for people. But I will say that if you feel like you'll need it for the rest of your life, you may find that in a few years that you'll be ready to give it a go again, but you won't need to. That'll be entirely up to you.
Shannon, there you go. Thanks so much for calling in tonight. Let's go to line 5, and on the line from Toronto is Bob. Hi, Bob. You're live on the show.
Hi, how are you?
Good. How are you?
I'm so glad you have a program on like this. I myself am a marijuana user. I suffered post-traumatic stress disorder as a result of just bad childhood. I was one of those people that condoned it. I was one of the people that said, it's not that bad, you know? I now am 54 years old. I've been diagnosed with COPD. I realize that it stabilized me as far as my post-traumatic stress. It was like a drink, but I didn't drink. I wasn't a drinker. I was not a heavy drug user, although I did try them. And knowing my own addiction or my addictive behavior, I knew that I could not do that. But I was of the age where marijuana was okay. And then I'll be the first one to say to the doctor, I agree with you 100%. You're one of the first people I've seen explain this so vividly, that we cannot medicate ourselves. We cannot diagnose ourselves. I live a decent life. I have real connections. I have responsibilities, but I also have an addiction to marijuana.
Yeah, it sounds like you're really regretful that you did take that path.
I was a singer, and you know what I always thought? The cigarette smoke. I was prescribed a drug for cigarette smoking. I don't know if I should name the drug or not, but it was very helpful. Very helpful in cutting back me from a 2-pack cigarettes a day to none. And I did that in 3 weeks. And I thought, well, if I can do that, why can't I stop smoking marijuana?
It's harder, yeah.
Because at this point, honestly, I don't know where to go. My doctors know that I've used marijuana for medicinal purposes, I guess. And I'm not so sure about that anymore either. I'm not so sure that's a good thing that we did that, and that we've put stuff forward that we were really just learning about. Like when that gentleman says he can drive across Canada driving big rigs. I mean, I don't drive a car if I smoke. I don't. I just don't. I know that it affects me in a sense that it will calm me.
Bob, we're going to jump in here. I'm going to let Dr. Tarman talk about what you've said this evening. Dr. Tarman?
Yeah, well, I want to say that it sounds to me like you're regretful, or you're maybe ready to think about getting off of it. And one of the things I can say, like a Renaissance, for example, might be an option for you. You know, believe it or not, we've had people come into Renaissance with only a marijuana addiction, because I want to say only, because it's a drug that's really hard to get off, and we don't give it the respect that we give the other drugs. And the people that have come in have found it tremendously useful to be in an environment in the same way as trying to get off of alcohol or cocaine, where they've got the support that they need. Like, you may well need support to get off of it. It's you know, it has a withdrawal, and the thing about marijuana withdrawal, unlike the others, is it's a very protracted and long withdrawal. Like, it can last for a month to 2 months, and unlike alcohol, which is what, 5-10 days, and then you know, you're physically feeling better. You may still be mentally craving, but the physical stuff is gone. Marijuana, the physical stuff can last for, you know, 2, 3, 4, 5, 6 weeks. So I really empathize with your sort of reluctance to get off, and you know, you're in a hard place because, you know, you've been on it for a long time.
So an option there for you, Bob, and we've got the number up for Renaissance for you at the bottom of the screen.
I do want to say that if you are interested to know that there is actually a Marijuana Anonymous program in Toronto. It's quite a thriving little 12-step program. I think there's almost a meeting every night, and it started maybe a few years ago because people found that there were enough people who wanted to get off and needed that daily support in the same way that as an alcoholic for Alcoholics Anonymous. So just look up in the phone book under Marijuana Anonymous, and you'll find that there's a community out there.
Yeah, you can also go on the internet. Bob, thank you so much for sharing with us this evening. We're going to take another short break here on Living Clean, Living Well. When we come back, they're lining up to talk to you tonight, Dr. Tarman. If you've got a phone call or a question that you would like to make this evening, make sure that you get on the phone early, because we'd hate not to be able to get to you. So a quick break here, and then back with more with Dr. Vera Tarman.
Is someone else's drinking affecting your life? Does it make you feel angry?
Don't yell at me because you're mad at your mom. She's the drunk, not me.
Does it make you feel sorry for yourself?
Hey, Tanya's drinking again, and maybe next time.
Or does it even make you feel frightened?
Does Daddy have to drink so much?
No matter how you feel, we can help. We're Al-Anon family groups, and we know what it's like. Just call 1-888-4-AL-ANON. To help them, you have to help yourself first.
The support circle was very important to me, and I realized that after being here for 2 years, and my 2 years is almost up, and I've stayed on it 2 years straight. Every month I came to the support circle, which you go back and you discuss how your life is now, any problems you have, any triggers that may occur, or what have you. Because you go back to the counselor and you discuss this, and you have your family members or your support circle, which your friends, close friends that support you in what you're going through. And you discuss all these things that are bothering you at this point, you know, if there is any, or if there is any, which more than likely you're going to have problems, but you learn how to deal with them so much easier. And that's the support.
Hi, I'm Oliver Piggott. And I'm Sebastian Piggott. Like most Canadians, we've seen the devastating effect addiction can have on the lives of close friends and family members.
We've also been fortunate enough to witness the power of recovery and see firsthand the way someone can truly reclaim their life.
If you or someone you love struggles with alcohol or drug addiction, call Renaissance. They offer compassionate, effective treatment in a supportive home-like environment.
They also offer groundbreaking services to family and children of loved ones affected by drinking and drug use. Don't waste this moment alone. Call now.
Let Renaissance be your shelter from the thunder. Let them walk you to the water.
Welcome back to Living Clean, Living Well, live on this Sunday night here on CTS, a proud presentation of the Canadian Centre for Abuse Awareness. Joining us tonight, Dr. Vera Tarman from Renaissance, and we are so glad to have you with us. Some great phone calls this evening. Yeah, lots of spirited discussion, some good insight, and also some wonderful questions. Glad that we're here. Let's go now to line 3, and Dave's calling in from Midland. Good evening, Dave.
Hello.
Hi, Dave. You're live on the show. How are you?
Hi, Dave.
I'm good, Teresa. How are you?
We're doing really well. Good to hear your voice again. How's everything going in Midland?
Everything's good. Everything's good in Midland.
Good. Did you have a comment this evening? Notice I didn't say question, because usually it's a comment, right?
Yeah, I have a couple points to make.
Perfect.
The first point I want to make is we're talking about harm reduction, and if I'm an alcoholic and I go to use marijuana, I don't consider that harm reduction. I consider that substitution. For me, harm reduction would be to maybe try to cut down my drinking to once or twice a week, or one beer a day, or whatever. And I know that doesn't work for me, and the substitution doesn't work for me either. You know, I know that I have to get to the root of the problem. For me, I had to get to the root of the problem to find recovery, because the alcohol and the drugs were not my problem. They were part of my solution. They were a symptom of my problem. And in the work I do as a peer support worker, I deal with a lot of people, and they just don't want to let go of the idea of using marijuana. And I just tell them my experiences, and eventually, they learn that for themselves. So, I believe it's just got to let it take its course, and hopefully most of them will come to see it that way.
Dave, did you want to pop in there?
Yeah, I just want to say, Dave, in my work at Renaissance, I sort of see two types of people in a way. The new people that are just coming in to ask for help. And then I see a sort of smaller group of people who are the people who have relapsed and they're coming back again. And of course I want to find out what happened. And one of the most universal reasons why people come back is because they said, well, I was clean, and then I thought, well, I'm going to pick up my marijuana, because that's not a problem. And it's a gateway drug. I mean, it's not necessarily right away, but 6 months later they're using back to their previous substance. It's only, it's like you say, it's not really a good solution if you want to be abstinent.
Dr. Tarman, I'd like to get your thoughts on the medical marijuana program. We've had some callers in over the last couple of months that have been asking about that as well. What are your thoughts on that?
On the medical marijuana issue? Well, that's a really controversial issue, and it's controversial because we just don't have any right answers, and the government is kind of sitting in this limbo itself because there's no right answer. My own personal opinion is that unless the person is where it's a palliative care situation, where the person is, has cancer and they're literally not eating, or they're on chemotherapy and they literally can't eat and it helps, I would be in favor of it in that context. But most of the people who really advocate for marijuana are not in that kind of debilitated state. They're in a state where they're using those arguments, but for they themselves, it's not that situation. And so that's when I begin to think, the benefits that you get from marijuana are just not worth the risks, which are not acknowledged because it's not considered a hard drug.
Did you ever prescribe medical marijuana?
Yes. So I mean, I used to think that it was a fine drug, a fine option for people who had chronic pain and had hepatitis C and migraines and various things. And I was somebody who was quite willing to sign those little compassionate cards. And even, it's a bit of an arduous process, but there's there's the federal larger document where you can actually get approval to grow it yourself. And I used to fill those out too. But when I got into addiction medicine and started to see the other side, the people who had been smoking for a long time, on a daily basis, a few times a day, and I saw how they were doing, I couldn't in good conscience prescribe it anymore. So I one day just made up my mind, I made a decision to say, I'm not filling out those forms anymore because it's just hypocritical to do so. I saw people coming with withdrawal, with their life. I mean, your life doesn't fall apart in the same way as alcohol. You may not lose your job, you may not lose your partner, but you become amotivated. It's more of a syndrome of a person doesn't live up to the potential that they could have, and I just couldn't be part of that anymore. Yeah.
Very interesting.
Yeah.
Back to the phones now. Let's go to line 4, and Grant's calling in from Spalding tonight. Hi there, Grant. You're live on the show.
Oh, how you doing?
We're doing well. How are you?
Oh, I'm doing pretty good. I read on the internet that marijuana is a soft drug, and it's about as addictive as coffee, where alcohol is more like, it's actually more addictive than cocaine. It sends off more pleasure receptors. How do you respond to that?
Well, I've read too that some people think that it's just as addictive as coffee and cigarettes, but not as addictive as cocaine or alcohol. But there's one thing about the research is really there's not a whole lot of research about withdrawal, and what we have to look at is clinical experience. And clinical meaning just, have you seen enough people quitting marijuana and start to see the patterns? And I mean, I'm an addictions doctor, and I've seen a lot of people coming off of marijuana. So I mean, I've got a fair amount of clinical experience, and my clinical experience is that yes, there is a withdrawal, and it's not as obvious as cocaine and alcohol because of the way it leaves the body. It's stored in the fat cells, and therefore it leaves the body slowly but long. And with alcohol, you know, you see this big dramatic picture of potential seizure and shakes and sweats. With marijuana, you don't see that because it's not, it doesn't go out of the body quickly, it goes out slowly. So it's more of a quieter but longer, more painful process of this irritability and anxiety and insomnia, and you don't want to eat, that sort of thing. So I think it's going to the same neurochemicals, just leaving the body more slowly. It's still addictive.
Yeah, Grant, does that answer your question?
In a bit, yeah, but I did read an article that said that marijuana actually increases intelligence in the hippocampus area.
Oh.
The alcohol destroys the cerebellum, where the emotional control point of the body is. That's why a person has so many emotional problems after you've been burnt on alcohol. Like, I don't see any difference. Well, especially when you're in a blackout. Aren't you PCP high?
Okay, so just to address the memory issue, one of the things that even marijuana proponents, people who advocate marijuana, will agree to is that it affects short-term memory and it makes you less motivated. Even they will say that. And we know in the research that, like with alcohol, the marijuana will actually decrease the size of the hippocampus, which is where our short-term memory is. So there is no question that there is an effect of memory. And as a result of short-term memory loss, you don't learn as well, because you need memory to be able to learn, learning to take in the information and keep it. So that's one of the things that is, there's no question about that one. It's maybe not as as problematic as alcohol, which affects more globally, more parts of the brain. But there's no question that it affects our memory. And I've never heard anybody say that it makes you more intelligent. I don't think that that's the case.
Grant, thanks so much for calling in. We also welcome your emails here on the show. Right now they can be sent in to sanderson@abusehurts.com. I received an email. We're on Facebook as well. You mentioned a little bit about alcohol. This one does deal with alcohol. This is Emily from Montreal, and she writes in to say, I'm in a long-term relationship with a wonderful man, but I'm beginning to think that he may have a drinking problem. What are some of the things that I should be looking for? So this is Emily from Montreal.
Okay, well, with alcohol, if you don't actually see it, I mean, the first thing to look for is the behavior. Is the person drinking more than you are? I mean, maybe that's not a good way to look at it. Are they drinking a lot? Are they drinking more than 1 or 2 drinks in one sitting? We have sort of guidelines that are considered safe. For a man, it's 2 to 3 drinks a day. And so if a person's drinking more than that, and more like 4 or 5 in one sitting, that's already a problem. But you can't go by that, because a person will often drink before they meet with you, and then they'll just drink the acceptable 2 or 3, and then they'll drink later. So you can't really go by that. But the other things that you can look for is the person has had a personality change. Like, have they become more moody or more irritable? With women, it tends to be more depressed and more anxious or depressed. Anxiety is actually a pretty big one. And with men, it's often more irritable and angry and looking for fights and jealousy and stuff like that, especially if it's a change from previous. And then eventually, if the person gets sick enough, you can start looking for other signs, like, if the person is drinking in the morning, you say, why are you drinking in the morning? Because you can see shakes. If they haven't had a drink for a day or 2, and they actually literally have shakes, that's a sign of pretty advanced alcohol dependency. I mean, it can become to the point where the person can actually have a seizure. But usually by then you know something's going on. But if you see those shakes in the morning or after a period of time, that's a sign that it's already pretty advanced into an alcohol dependency. Yeah.
Thank you very much for that. That's for Emily from Montreal, one of our email questions. Time for another break here on Living Clean, Living Well, but when we come back, we'll take more of your phone calls and more insight from Dr. Tarman. We'll be right back.
I'd like to talk to that lovely lady, Teresa. She's very nice. She reminds me of my daughter. And she's always friendly. You know, they don't teach kids these days how to be friendly. But I think the show is boring, and I'm going to tell her that myself, because you got to tell a joke or something. Like, people love a good laugh, and I know a couple of good jokes. I'm going to tell a joke tonight, and nothing too rude. I know my boundaries, and I know they speak of that as well. But I wonder who they have on today. I like that. That man, what's his name? Or is it a woman? Anyway, they're on all the time. They're always talking about drugs and things. But I'm learning a lot. And I'd like to teach my grandchildren what not to do. And
welcome back to Living Clean, Living Well, everybody. I'm your host, Teresa Cruz, along with Dr. Vera Tarman tonight. We've had some interesting discussion, talking a little bit about harm reduction, the use of marijuana, some calls about alcohol. You know, obviously a hot button issue with the marijuana. You got into a little bit about the medical marijuana program. Where does it help people, and what sort of afflictions is it that people are using medical marijuana for?
Well, the medical marijuana is really the way that you can get approved to use it is if where the research and people say it helps is that there's sort of three things that it does that are supposedly it really helps. It's supposed to help for pain. So for people who have chronic pain, and especially if they don't want to take opiates and they don't want to well, because the opiates are not working or they don't want to take them, they say that the medical, or they say that marijuana helps. So that's one thing. The other thing is that it's supposed to help for nauseousness, and if you can't eat, like if you've got cancer or you're just really sick all the time because of hepatitis C or something like that, it's supposed to help with appetite and for nausea. The other thing is it's also an antispasmodic, so people say it's good for MS, people who've got MS or ALS or one of those motor, one of those conditions, muscle conditions. That may well be true. And what the medical angle is that while those things may be true, there are other medications that do the same thing and they don't have the same side effects. Because the other big thing is for glaucoma. It does decrease the ocular pressure in the eye. So that's great. But you have to be on a fair amount of it, and you're pretty high. And that's a big cost to pay if you're actually treating it for those conditions. And as I said, for the physician, they're more likely to say, yes, there is maybe some use, and the research isn't out on that completely. There may be some help to it, but you're paying a big price for it in terms of intoxication and danger to yourself and health concerns, like a fellow who talked about a COPD. And other concerns like memory loss and whatnot. So the general tendency tends to be that doctors don't really want to prescribe it. And so much so that the American Society of Addiction Medicine, you know, the body that regulates addiction doctors, has made a white paper last year, 2011, saying while there may be some benefits to marijuana, we do not advocate it because of the larger negative qualities to it. So, I mean, that's kind of where we're sitting with it.
Where are we sitting with it in Canada? I mean, it's allowed?
Yes, it's allowed. I mean, there's two ways that you can get it. You can get it through this federal approval by getting this compassionate release form. And if the doctor will say that you have a palliative care condition or you have a debilitating condition, they don't actually, it's not, all they have to do is say that, and then the person can then actually obtain it legally. It's a legal thing then, and they can actually grow enough of it for themselves and not get arrested. But you can't find very many doctors who are willing to do that. even though they're allowed to do that, and they're not saying I approve of the use. They're just saying the person's got this condition, and that's that, and that it would be an acceptable treatment. But most doctors are very reluctant to do that. So what ends up happening is that people get the second way of getting the drug, which is a sort of semi-legal, illegal. It's a limbo place, which is where you get this little card that says that you have conditions like hepatitis C or glaucoma or chronic pain, which will enable you to then go to these what they're called compassionate care clubs in cities like Toronto, and you can go to this club, which is usually a storefront somewhere, and then you can actually buy marijuana. You don't grow it yourself, but you can buy it from them.
I was watching a crime show on television, and they were getting ready for some big heist or whatever, but I think it was one of these clubs that you were talking about.
Yes.
And somebody walked in, and it was like buying a fine bottle of wine.
Yeah.
The way that they were describing, well, we have this, and it'll do this for you, and we have this, and it'll do that,
Yes,
and some of the attributes. Is that how it works?
Yeah, like
to your knowledge?
You can go to one of these storefronts, these little shops, and they might have 20 or 30 varieties of different types of marijuana, because some marijuana is very stimulating, others is very sedating.
I didn't know there were that many varieties.
Yeah.
Holy crow.
Oh, sure. So there's all sorts of different, I mean, breeders or growers will actually breed seeds and create a particular quality of a stimulant with a bit of a depressant attached to it, and they'll give it a name, and then I mean, they even have tournaments, like they have every so often this big tournament in the States, in Europe, where you try to win the best seed of the year or something like that, just like a wine testing contest. But I should say that these little clubs are not really legal, and they get raided every once in a while, every 6 months or a year. I don't know what happens to them, but the people who buy, you don't really get arrested. I think you get hassled by the police, but it's not really arrested. So it's not really legal like the first way is. Yeah.
No, that's some good insight there. Our phone lines are lighting up again. Let's go down to the line 2. Our nation's capital, calling in from Ottawa tonight, is Conrad. Hi, Conrad.
How you doing?
We're good. How are you?
I'm really good, and I really appreciate, shows where there are people like you who are giving information to those who need it. But I'm a little appalled that you two are talking about addiction like it's a walk in the park. It's a life and death struggle. I speak at detoxes. And I'm not there to coddle people through this. I'm there to tell them exactly what it is and what my struggles were. And if I didn't have people who kicked my butt, excuse the language, I would have never made it. And, it's a life and death, everyday fight. We talk about the addict being in the corner waiting for us. Well, my addict doesn't even get that far. My addict's, right in my head, chattering at me all the time. And, I really appreciate you two being there, but it's a little more rough than, there are people who are struggling, and you can't hold their hand through it. You've got to tell them.
You know what, I'd just like to say something, Conrad. You know what, when you're dealing with this week in, week out, it's almost like you become a medical doctor where it's just very matter of fact. But you're right, and we have had guests on that are in recovery, and some of their stories are absolutely awful what they went through. And you're right, Conrad. We are here to hear from people like you as well. And you're right. We'll be the first to say it's not a walk in the park. And sometimes we get in this show we have a lot of information to get out. So maybe that's what you're hearing tonight. But Dr. Tarman, I'll let you talk to Conrad.
Well, Conrad, I'm really curious to know, what is it that you would like to say that would be a kick-ass message?
Like I said, I'm so thankful that there are people that can come to you on a show like this. And like you said, you do this on a daily basis. Well, I do too. Like, I'm in a 12-step program. Can't go any farther than that. I'm in a subcommittee of it, and I deal every day, like you do, with recovering addicts. And I speak the language that which was so gratefully given to me from my predecessors, but nobody pulled any punches. I'm a hardcore addict from the streets of Chicago. And like, I'm not here to, you know, hold it. And, you know, yeah, we do get a little, I don't want to use the word jaded because we see it every day and we have to deal with it in a calm way. But if people were calm, I would have never got the message. I would, you know, I'm one of those, some people you can tap on the shoulder to get their attention. I'm the one you had to hit over the head with a 2x4.
Yeah. Yeah, well, I can appreciate that. So you're the type of person that needs to be hit over the head by a 2x4. One of the things I've learned is that even with the 2x4, if a person's not ready, it's not going to work. And sometimes having a gentle touch is just as effective. I don't know how much it matters. I hear that it mattered to you. It would be good if we could have a sort of approach that does all of those things. But I think my guess is that you were probably ready to hear it in a way that sometimes people are just not ready. Because I've tried the hard, you know, in-your-face approach, and people just end up backing off and saying, "Whoa, I don't want to go there. This person doesn't understand me. They don't want to hear me." But I know what you're saying, that you can be too much on the other side too, and be too almost enabling, too gentle. Yeah.
Conrad, did you have anything else to say? Because one thing that we pride ourselves on this show is that it is an open forum, and we welcome phone calls like yours, people that have been there, people that, you know, that have a lot to offer. Conrad, I'll open the floor to you. I am running out of time, but go ahead.
Help a little more than I do because I'm pretty well on my way, so thank you very much.
All right.
Thank you, Conrad.
And we thank Conrad for calling in. You know, sounding a little bit too matter of fact, you know, he does maybe bring up a good point, but sometimes there's a lot of information to get out there, you know.
That's right, yeah.
I can't imagine you being in somebody's face, the kind, gentle person that you
no,
are.
sometimes I can be pretty in the face, like when the person's saying, I keep trying, and I say, no, let's not use the word try. You do or you don't. And you're not right now. And then they'll say, yeah, I'm not. But you know, if they just end up leaving, then I haven't done any service there either.
Yeah.
So it's a hard one. Being a professional in the field, if you're actually an addict in the field doing your service, that's one of the things that a person who is in recovery, that is something that they can bring to that I can't as a professional bring, because they can do the in your face, because I've been there and this is it. I don't quite have the same luxury because I've got to, you know, have a professional demeanor, and I have to give alternatives other than the in your face.
And then there's always the issue of tough love, right?
Yeah, that's right.
When to use that.
Yes. Well, ultimately, I have to use that too. You know, here are the rules, and if you don't follow them, you know, that's the best I can do for you. Yeah. But how you do that is another matter.
Yeah, that's interesting. Some good insight from the medical profession, and also from Conrad as well, someone that has been there, like you said, the tough streets of Chicago.
Yeah.
We're going to take our final break here on Living Clean, Living Well, but when we come back, we will have some final thoughts from Dr. Tarman, and I'll tell you who's coming up next week. So our final break, we'll be right back.
Statistics state that it is likely you know a victim of abuse. It could be a friend, a relative, a colleague. It could even be you. 1 in 3 girls and 1 in 5 boys will be sexually abused before they reach the age of 18. Please give them hope. Help us make it stop. Go to abusehurts.com and give to the Canadian Centre for Abuse Awareness.
Welcome back, everybody. Some final thoughts from Dr. Tarman. Big issue that we placed on the table tonight was the matter of harm reduction, using marijuana, using it in the medical, medical field. Your thoughts, Dr. Tarman? This is a controversial one, I know.
Yeah, well, it's a controversial one, and so, you know, harm reduction in itself is a controversial area. So, you know, to be fair, from the harm reduction point of view, marijuana is, I suppose it's better than a person, you know, I don't know, using cocaine or something, or alcohol or something like that. But I'm coming from an addictions, abstinence point of view. Like Renaissance, we really promote abstinence. And I'm going to say that it is a drug like any other drug. It doesn't look as bad because, as I said, it's a slow-acting drug. It goes out of the system in a slower way. but it has just the same kind of potency. It has a lot of the dangers with it. It's just as addictive as any of the others. So that's my message overall. It's not a benign drug, it's a dangerous drug.
Dr. Tarman, thanks once again.
Yeah, thank you.
Looking forward to seeing you again on Living Clean, Living Well. And we're looking forward to seeing you. Coming up next week, we are going to be having Don Slesser, who is a very well-known addictions therapist, and he will be on with a special guest. So we hope to see you again next week. Thank you to Dr. Tarman, and thank you to you. We'll see you next Sunday night. Have a good week, everybody.
Living Clean, Living Well has been brought to you by Turning Point Detox and by Renaissance. Living Clean, Living Well has been a presentation of the Canadian Centre for Abuse Awareness